Okay, everybody, thank you for coming out. First of all, we're really appreciative that you took the time to view our presentation. Our study is entitled Mask Wearing Behaviors Among San Diegans. And this study was conducted October through November, a little bit of December as well, but we're gonna say October through November. So this is the aptly named Risky Business Team. We're gonna introduce ourselves individually.
Hello, everyone. My name is Vince. I am a second-year transfer. I'm studying public health like all of my group members here. Yeah, and it's really great to meet you all.
Hi, everyone. My name is Daniella. I'm also a public health major, and I'm minoring in biology, and I am a fourth year. I did not transfer, so I've been here for 4 years.
And like Vincent, I'm a second-year transfer as well. Happy to be here.
Hello, everyone. My name is Eric Wang, and just like Daniella, I'm a fourth-year public health major, and I'm double minoring in business and political science.
Okay, so the purpose, to provide a little background of our study, the study initially was conducted only at the UCSD campus. However, it became clear that those observed on campus had a high level of mask wearing adherence, which is a great thing, by the way. Congratulations, everybody. We wanted to see if this behavior continued in areas where students may travel while off campus. As our research questions evolved, we broadened the scope of our observation to all San Diegans in the 7 locations observed. We're going to go into that. But so the problem we're trying to address is that there currently is no data on mask adherence within the community of San Diego County. Our study's purpose is to evaluate the public adherence to statewide mask policies, which contribute greatly to the safety of our community. And next slide, please. So why is this project important? Mask wearing is one of the simplest and most effective means to prevent the spread of SARS-CoV-2. Mask adherence affects the ability to reopen. San Diegans are required to wear masks in outdoor settings, indoor as well, but we didn't observe that. Little is known about compliance, as I've already stated. And this observational study was undertaken to examine outdoor mask behaviors in San Diego, October through November. Mask adherence truly affects the ability to reopen businesses. So from an economic standpoint, that's important. A public health standpoint, that's important. And next slide, please.
Okay, so for methodology, we conducted an observational study surveying popular locations throughout San Diego County. We chose 7 locations to survey on a randomized schedule, particularly during evening hours and on weekends for a duration of around 1.5 hours. The locations we chose were Fashion Valley Mall, Convoy, SDSU's, Trader Joe's, UTC, Little Italy, Ocean Beach, and Pacific Beach. We chose these locations based on anecdotal knowledge, and every visible member of the public was included, except for those who were within designated dining areas where not wearing a mask is allowed. Next slide. So for frequency of observation, it was convenience-based and dependent on the ability of the researchers to enter data, and we used Qualtrics to keep track of the data. Using Qualtrics, we linked the following data points per individual. The first one was mask type, which consisted of bandana, neck gaiter, cloth, surgical, and N95 and other respirators. We also did facial coverage, which consists of full cover, no cover, mouth only, chin only, and mask present but off, like maybe they're holding it, or as long as it's visible, that's what we categorized it as. We also did age group, which was simply age, college age and under, or college age, above college age, sorry. And lastly, we checked whether or not people were touching or adjusting the mask during time of observation. We then exported the Qualtrics data into Excel for data analysis and also to graph our data points.
Alrighty, so here were our results. We took 6 main metrics. Yeah, there we go. And the first was full cover mask adherence through all of San Diego. And our sample size was 2,641, so fairly large. And what we found was that through all of our observations and all of our locations, 66% of subjects overall were fully covered, and that means that they wore their mask, whatever material it was, and they covered their mouth and their nose. And we found that a total of 12% either covered their chin only, we call that colloquially the chin diaper, and mouth only. And surprisingly, 22% of people overall we found were not wearing any mask at all, and that included whether they were even carrying one. Next slide, please. Yeah, so the second metric that we took was mask distribution, mask type distribution throughout San Diego County. And what we found was that 69% of people overall were either wearing cloth or surgical masks, with cloth being the most popular at 42%, so short of half, and surgical at 27%. Not that many people were wearing neoprene, gaiters, N95 and other dust masks, as well as bandanas. And we all know that they have varying efficacies when it comes to spreading respiratory droplets. And once again, we found that 22% of people weren't wearing any masks at all. Next slide. So our third metric was full cover mask adherence, sorted by location. And what we found was that when people tended to be going out shopping or something of the sort, so Fashion Valley Mall, Convoy Plaza, Westfield UTC, and partially Trader Joe's, mask compliance tended to be a little higher. So places where there might be a little more reinforcement because they're going into establishments that require mask wearing. But then we compared that to places like Little Italy, India Street, Ocean Beach, near Sunset Cliffs, and Pacific Beach. So essentially places where there's more recreational activity, such as going out to drink with friends, going to bars. And this was before the everyone got that Amber Alert earlier regarding the stay-at-home orders. So people were really not adhering to mask wearing guidance in these areas where they were going out for recreational activities, and especially at Pacific Beach and Sunset Cliffs. Alrighty, so our fourth metric was on mask touching and adjusting at the time of observation. So while when we were recording each person as they passed by, or groups of people, we would be just checking in that moment whether they were adjusting or touching their masks. And the reason we chose to measure this was because a lot of people wear masks that are ill-fitting, and what we notice is that when masks are ill-fitting, they tend to be touching their masks a lot, moving it up to try to cover their nose. Sometimes what we've noticed is that when people try to open their phones, especially when it has like facial recognition technology, they pull down their masks to expose their face so that their phone can unlock. So but at the moment we found that at the time of observation, only about 95% of people, 5% of people were adjusting at the time. And our fifth metric, we sorted mask adherence by day of the week. So we made a point of observing on every single day of the week, just so that we get a good sample size, and we randomize our locations. So we minimize bias, and so we weren't searching for people who were disobeying mask adherence guidance. And what we found was that it wasn't necessarily like a pattern, but people were adhering to mask guidance mostly on Sundays, Mondays, and Thursdays. Not so much on the weekends and Tuesday and Wednesday. So not necessarily a pattern, but just interesting to see. So this might have been one of our more interesting metrics. So we did full mask adherence, and we sorted that by age group. And so what we did was that we observed participants, and we, based on the researchers, we determined whether this person was younger or at or younger than college age or older than college age. And by college age, we mean 30 years old. We based that cutoff on past research conducted by the Hamilton Project and other literature, where the age distribution of college students and especially undergraduates, over 1 in 5 students in the United States for undergraduates is above 30. So the majority of them are below. So that's why we chose 30 as our cutoff. And what we found was that there wasn't any statistical significant difference based on our chi-square value between for full mask adherence between age groups. And that was interesting because we went in with some, preconceived notions, but what we found was that they're essentially the same. So, whether you're older than college age or younger than college age, they're very, very similar in terms of full mask adherence rates.
Okay, so some of our strengths and limitations. Some strengths that we found, we had a very large sample size. We had 2,641 subjects to be able to analyze and observe. This is a really good thing in terms of our study, but not a very good thing in terms of limiting COVID exposure. So our data collection methods, we used, as said before, we used Qualtrics, and that made it very easy for us to analyze data. I'll go a bit more into Qualtrics in a later slide, but Qualtrics was very easy in order to analyze all of our data points. We had a very straightforward data analysis due to Qualtrics. It made it very easy to kind of integrate all of the data and analyze it. We also had a wide range of locations. We had locations all across San Diego County, including Ocean Beach, Pacific Beach, SDSU, Trader Joe's, Fashion Valley, UTC. So that definitely allowed for a wide and diverse sample size. So some of the limitations that we found, we were only surveying outdoor areas, so none of our data includes whether there was high mask adherence inside businesses, inside restaurants. So that is not included in our data. And another limitation was that age was often difficult to determine. So we were looking at older than college age, and younger. And oftentimes that was very difficult to determine who was college age, who was older than college age, especially when you got around the late 20s, early 30s. It was kind of difficult to tell, especially due to the fact that they were masked. We couldn't really see their entire face. So it was a bit difficult to determine their age. There was also little population data to determine locations of observation. So we weren't exactly sure where it was particularly population dense and where there would be less people. So we kind of had to do based off of our own knowledge of San Diego and where we thought people might go. And it turns out that we did have a pretty good assumption, but there was little population data in order to provide us with that thought. Okay, so some lessons learned. I just wanted to start off this. We did initially start our study only at UCSD, so we were fortunate enough to be able to kind of do 2 different studies pretty much, and be able to change our methodology kind of midway through, which was very fortunate because we did learn a lot of lessons. So one of our lessons was robust methodology leads to more uniform data collection. So we all were very familiar with what we were observing, how exactly to go about that observation, and how exactly to enter it into Qualtrics. We initially used an app called Counter App, which it was easy to collect data, but it wasn't very easy to analyze that data. So we found that Qualtrics made it very easy to analyze. We also initially with the UCSD study, we kind of did more of a convenience-based location choosing. So wherever we kind of wanted to go, we went. Whereas with this study, the calendar was more randomized. So that made it less subject to bias. Another lesson that we learned was to explore all options for data collection methods, including applications. So this kind of is mentioning the fact that we initially used the Counter app, which is basically just an app where you press and it will count. And we found that was very difficult to analyze the data with. So then we switched to Qualtrics, which made it a bit easier to analyze the data. Another thought that we had was that we could go in teams of 2. We only went in 1-person teams just because scheduling, it made it a bit easier to go just single person. So we thought that maybe if we did teams of 2, it might increase the amount of data collection points we could get, just because Qualtrics, it does kind of take a lot of work to enter each survey. So we thought maybe bringing a team of 2, we might be able to increase the amount of population we would receive. Okay, so some conclusions and recommendations. So one of the conclusions is that 22% of subjects wore no mask at all. This is quite concerning, but yeah, so 22%, which I guess is low comparatively, but yeah, we definitely want to get that up. So location skews mask adherence rate. As you saw from previous slide of the graph, the OB and Pacific Beach had quite a low adherence rate, whereas Convoy, Fashion Valley, UTC, places where you were going into businesses had quite a high adherence rate. So we thought that that might have something to do with it, possibly because OB and Pacific Beach, that's more of a different setting. You typically go there either to drink or to hang out, whereas Fashion Valley and UTC, Convoy, these are all businesses that you're going into, and you need to wear masks into businesses. Another interesting finding was that there was no statistically significant difference in adherence between age groups. So it didn't matter if you were older than college age or younger than college age. We found that there was no difference in the amount of adherence of mask wearing. So some recommendations that we have for future researchers. You should observe in areas with adequate visibility and sample size. So essentially meaning you're obviously looking at masks. And if you go too late at night, it might be a bit difficult to see who exactly is wearing a mask, what type of mask they're wearing. So we recommend going with areas that are well lit and are also very population dense in order to gain a high sample size. Another recommendation that we had was further randomizations of collection time and day. So as I said before, we did randomize our collection time and day by essentially just assigning a number and randomizing that number. We do think that it might decrease bias present in the study if you furtherly randomize it. Also, another recommendation is more fluid data collection method. So as I said before, we used Qualtrics. Qualtrics was quite difficult to move very quickly. If you were in a very population dense area, it was quite difficult to keep pressing in all of the answers on the survey. So we found that we couldn't get every single person that was present at our location. So maybe if you find a more fluid data collection method that integrates both easy analysis and quick data collection, that might work better.
We want to conclude our presentation with a quote from Dr. Fauci. If you don't want to shut down, at least do the fundamental basic things, really the flagship of which is wearing a mask. And now we're going to open our presentation up to questions.